QIMRBerghofer is one of Australia's largest and most successful medical research institutes. We're recognised worldwide for the quality of our work in three main areas: cancer, infectious diseases, and mental health and complex disorders. Our vision is simple: better health through medical research.
We're very much involved in having an impact on patients. We do research that must have a consequence. It's one of our logos here, research with consequences. To do that, you need to have top-class scientists, and we're attracting these from all around the world.
QIMRBerghofer is home to more than 600 scientists, students and support staff in 5 research departments and more than 50 laboratories. Many of our senior researchers devote their time to malaria. Malaria is caused by protozoan parasites, which are spread from person to person by mosquitoes. Those parasites are becoming ever more resistant to the malaria drugs available. There are 250 million malaria cases and nearly 1 million deaths from the disease each year. The World Health Organization estimates a child dies from the disease every 30 seconds. Australia isn't immune. There are up to 600 cases here each year. QIMRBerghofer scientists are tackling the disease from many different angles in an effort to better treat and prevent malaria. Professor James McCarthy heads our infectious diseases program and is lead physician on clinical trials underway in Brisbane to test potential drugs and vaccines.
So scientists at QIMR are doing a series of really important studies in human healthy volunteers who live in Brisbane, where we are developing drugs for malaria and testing them in these human volunteers by infecting them with malaria, testing how good those drugs are at curing them of their infection. These studies are really important because they enable us to bring malaria drugs to the developing world where malaria kills millions of people.
Denise Doolan is working on new approaches to developing effective vaccines.
Vaccines are considered the most effective way to protect people against infectious diseases, but vaccines are not available for a lot of diseases such as malaria. So we are working on a new way to try and identify the key parts of the malaria parasite that should be included in a vaccine.
And Christian Ingwerder looks at how our immune system responds to malaria.
We're particularly interested in understanding why sometimes we respond in such a way that causes disease, and other times we can actually respond and protect ourselves against those sorts of infections. Our findings have implications for vaccines and also for therapies to treat these types of diseases.
As ever, the research needs your help. QIMRBerghofer is a not-for-profit organisation. For every $1 we receive in research funding, we need another 65 cents to make the research happen.
The community is essential to what we carry out here at QIMR. We need their support financially, and we need their support in terms of them understanding what we are doing. With their support financially, we're able to do more, we're able to achieve more, we're able to do better science quicker, with better equipment and better people. And always the contact with the community allows us to see what we should be doing, to listen to what their needs are, and to act and focus our research on those needs.
Every day the work into malaria goes on, as the generosity of the community allows our important work to continue, to help save lives through science.